Today we will be reviewing the pathophysiology of concussion. My name is Allie Folkert, and I am a licensed and certified athletic trainer. Moving right into the normal function of a neuron, we know it involves receiving, integrating, and communicating. In a happy neuron, neurotransmitters are released in an organized manner, which triggers the next cell with its coded message. Described as a neurometabolic cascade, when an athlete suffers from a concussion, there is a complex cascade of ionic, metabolic, and pathophysiological events with microscopic axonal injury. The stretching of neurons causes collapse of normal functioning of the nerve cell. Potassium, seen in red, is going to leak from the stretched nerve cells. This increases the demand for glycolysis. As that potassium leaks out, calcium ion, seen in purple, will rush into the nerve cell. Unfortunately, there is a decrease in cerebral blood flow during all of this chaos, and the demands cannot be met. During this metabolic crisis, there is an energy crisis as well. This causes a mass release of neurotransmitters, which is overwhelming and hampers communication. Because of the vulnerable state of the neuron, any further stress or injury could cause serious damage. This neurometabolic cascade can take many days to return to normal. Within this graph, we can see the rapid increase of potassium and calcium. The potassium normalizes in about 12 minutes. The calcium doesn't normalize for up to 6 days. We can see the glutamate and glucose representing that hyperglycolysis state, with glucose returning to normal after 20 minutes, but then falling below levels after 6 hours and remaining there for 6 days. We can also see the cerebral blood flow is diminished after only a few minutes and remains there for the same 6 days. By using this information in a clinical setting, we can move forward by discussing proper return to play protocols and recognizing that every single patient is different. We can utilize the clinical profiles within our practice as well to help direct proper management and treatment of a concussion. Cognitive or fatigue shows up as decreased concentration, increased distractibility, difficulty learning or retaining new information, or decreased multitasking abilities. Vestibular involves impairments of the balance center. It affects the ability to interpret motion, coordinate head and eye movements, or stabilize vision upon head movement. Oculomotor brings difficulties bringing eyes together or moving eyes to track motion. Post-traumatic migraine involves unilateral, moderate to severe intensity headache with a pulsating quality. Cervical mechanism of injury affects extracranial region, including neck and or spinal cord. And finally, anxiety or mood. The patient has a hard time turning thought off and suffers from excessive worrying or concern. All in all, it is important to be familiar with the pathophysiology of concussion so that we as clinicians are able to correctly evaluate, recognize abnormalities and differences between patients, and treat the patient to the highest quality to allow for a safe return to play. Thank you for watching.